Good afternoon, everybody. Welcome to the, I almost said Christopher Iannello Chamber, but we are in the Piemonte room today as the Iannello Chamber is being reconstructed to be completely accessible to all. This is a committee on City Neighborhood Services and Veterans Affairs. My name is Tim McCarthy. I'm the District 5 City Council and the chair of this committee. This is a hearing for docket number 0918 in order for a hearing in regarding the healthcare provider parking permits in the city of Boston. This matter was sponsored by my colleague, Councilor Zakem, to my right, and it was referred to committee on June 21st, 2017. I'm also joined by my colleague, City Councilor Sal LaMattina, and City Councilor Michael Flaherty. We are also joined by Commissioner Fiandaca from the Boston Transportation Department, Commissioner McCosh from the Disability Commission, and Commissioner Shea from the Boston Elderly Commission. So at this time, I'd like to turn it over to the sponsor and my colleague, Councilor Zakem.
Thank you, Mr. Chairman. I want to thank my colleagues and Councilor Flaherty, who is also a co-sponsor of this order, and the commissioners for being here today. This is an issue that has really just bubbled up through constituent inquiries to my office and to me personally over the past few months, and particularly in light of the increased parking meter fees in Back Bay, in District 8, where I also represent. This has become an increasing issue for seniors, for folks who obviously rely on home care attendants, and there's really not, they're sort of lost where to go. So we wanted to convene this hearing to talk to the relevant departments, obviously hear from the public, from folks who are working in this space about what's needed and what we can do, whether that's an administrative change, whether that's legislation from this body, or whether it's about getting information out there, as is often the case, about existing alternatives. But I do think it's incredibly important that as we as this council and the Walsh administration embrace and put forth so many policies trying to make it easier for folks to stay in their homes, to age in place, to stay in our neighborhoods, we have to be looking at this holistically. It's not just, I think, about access to health care, which obviously Boston is a great place for that, but it's about some of the smaller things that we may not always be thinking about the impacts day to day, where the balance of preserving parking for residents, but also making sure those same residents are able to get the care they need every day. And from home health care workers who, are certainly not compensated at an acceptable level, and that's a whole other discussion, but we should not be putting a further burden on them through parking fines and paying for private parking, et cetera, et cetera. It's just untenable. So I'm really here to learn. I'm here to explore new ideas, obviously from my colleagues, from the commissioners here, and from anyone who has a view on this. And I think it's important that we continue moving forward and taking this holistic approach. So thank you, Mr. Chairman, for arranging this, and I want to thank my co-sponsor, Councilor Flaherty, as well, for his partnership.
Thank you very much, Councilor Zakem. Councilor Flaherty.
Thank you, Mr. Chairman. I'd like to take this opportunity to thank our colleague, City Councilor Josh Zakem, for taking the lead and for including me, as well as you, Mr. Chair, for taking the time to host this hearing, as well as our three commissioners from the Disabilities Commission, Transportation, and Elderly Affairs. This matter is something that we hear about pretty regularly as we're out across the city, mostly from seniors and from disabled residents, but also from families who are going through the process of losing a loved one. They're sick and they're dying, and hospice is in. Hospice paying such critical care. They're like guardian angels, and they swoop in and they're getting parking tickets left and right, or a relative will be in visiting, helping supplement hospice, taking care of a sick loved one, and they too are also getting stacks of tickets. So given that other cities across the country have processes in place, I'd like to work with Councilor Zakem and my colleagues here in the council, as well as our three commissioners and other interested stakeholders to take advantage of technology, implement some new policy that is compassionate and forgiving, at the same time put something in place that's very fair and consistent across the board. So whether you're a home health aide or you're a family member trying to visit a relative that's dying, that you'll have some type of mechanism by which you'll get a placard or a pass by which you won't amass tickets, or if you do get the ticket, there's some type of policy in place that's reasonable and compassionate that will exonerate the individual that has the ticket or a series of tickets because you're staying with a loved one who's dying or you're taking care of somebody. So with that said, I'd rather hear from the professionals. They know it better than anybody. So thank you, Mr. Chairman.
Thank you very much, Councilor Flaherty. Councilor Mattina?
Thank you, Mr. Chairman. I'll be very brief. Oh, I'm sorry. First, I want to commend Councilor Zagan for this resolution. It's long overdue. And I'm so happy that we have the three commissioners here because particularly in the neighborhoods, I hear a lot about the healthcare workers who get tickets, but also from our seniors when we put up resident parking. We receive a lot of complaints about now they can't have the kids come over and take care of their parents. I also know that there could also be abuse with this, particularly people getting the plackets so they can go to work. So I think that we really should look at this. Maybe they will have to get a doctor's note or an age. They have to be like 80 years old or older to get one of those visitor passes or something, because I know that particularly in the neighborhoods that I represent near the T line, that there could be abuse. But with the healthcare workers, we definitely need to do something for them. Thank you.
Thank you very much, Councilor Mattina. Councilor Sabi George? Okay. I just want to, for the record, just read quickly into the record a letter from a local 1199 SEIU. I won't read the entire letter, but basically this letter is in support. Reports of workers having to park as far as a mile away, workers reporting significant stress when traveling, especially into Boston, to try to find parking spaces. Being on time is certainly a critical issue for our healthcare providers, and many of the healthcare providers having to pay tickets because of the residential parking restrictions. SEIU has 56,000 healthcare workers across the Commonwealth and more than 5,000 members living in Boston. So at the end it says, for these reasons, we strongly support healthcare provider parking permits for workers delivering services across the city, including personal care attendants working through Mass Health Program and agency healthcare workers. We thank Councilor Zakem and Councilor Flaherty for bringing this issue forward, and the entire committee for taking this under serious consideration. So I will turn it over to the island of commissioners over there. So whoever wants to open up, welcome.
Thank you, Councilor. Councilor McCarthy, Councilor Zakem, other councilors. I want to thank you all and thank Councilor Zakem for bringing this important issue before the council today. On behalf of Commissioner Fiandaca and Commissioner McCosh, we really appreciate the opportunity to talk about this issue. As you know, older adults are Boston's fastest growing age group. 88,000 people over 60 resided in Boston in 2010, and UMass estimates that today we have close to 103,000 people over 60, and by 2030 we'll have close to 130,000. So under Mayor Walsh, we're building an age-friendly Boston, working to make Boston the best place to live and to age. Part of aging well and living well is having access to supports that allow us to age with dignity, including the essential assistance our dedicated home health workers provide to seniors, assistance with personal care, medications, meal prep, and other important home supports. In my office, we hear often from older adults who are having trouble accessing the care they need due to parking for both paid and unpaid caregivers, so similar to all of you. But I understand this problem doesn't have a simple solution. I live in Boston, and I know the challenges that come with resident parking for all residents of our city. I think we need to think creatively together, look at best practices from other cities, and create recommendations that fit our city and our residents' needs. At the Elderly Commission, we stand ready to work with our City Hall partners, Commissioner Fiandaca and the Transportation Department, Commissioner McCosh and the Disabilities Commission, you on the City Council, and also our community partners, important partners in this effort, so the Home Care Alliance, Home Care Aid Council, Boston Center for Independent Living, our ASAPs, Ethos, Central Boston Elder Services, and Boston Senior Home Care, and others to find a solution to this challenging problem. To make Boston a truly age-friendly city, we need to address parking for caregivers.
Yeah, well, yeah, we'll continue on with you, and then we'll
Okay.
bring it back for questions.
Thank you, Councilor Zakim, for filing this important order, and Councilor McCarthy for convening this group. The Transportation Department has worked closely with Commissioner McCosh as well as Commissioner Shea and their offices in identifying what the needs are for these particular populations. We know that as we address the needs of parking for our residents, that also creates a dilemma for some of their caregivers. And we understand how critically important it is that we provide the support mechanisms that allow people to remain in their homes. I think all of us have been sort of touched by this issue in one way or another, and we know that as we encourage people to age in their own homes with the support of their family and all of the services that the city offers, that it's important that they have access to those parking spaces and not be unduly burdened by a well-intentioned resident permit program. So we look forward to continuing the conversation with Commissioner Shea and Commissioner McCosh and identifying solutions to this issue, convening a working group that can really help us delve into exactly who's best to determine the needs of this group and how such permits or placards would be distributed and maintained in a fair and equitable manner so that we're really responding to the needs of our residents.
Thank you, Councilor McCarthy and other members of the City Council for having me testify today. My office works a lot on parking. We run the accessible parking program for the city, and a majority of our staff time is spent on parking issues, so we know the challenges. That being said, we also spend a lot of time listening to community members. Our focus is mainly on people with disabilities, younger people as well as older people. And one thing that we've heard from them for a long time is parking for caregivers. So about 5 years ago, we implemented a small pilot program which gives a placard to a resident who has a severe disability. And the requirements for this program are that the disability is so severe that the person needs the care to remain in the home and not be institutionalized. So it's a very small group of people that we've issued placards to, about maybe 8 people at the most. We've only had about 20 applications. And what this program does is it gives the person with a disability a placard that they can give to their caregivers to park in resident-only spaces. And they actually put the parking license plate numbers on the permit, so they're allowed up to 2 license plate numbers on the permit. We working only with personal care attendants and not other home caregivers and not family members. And the reason we did that was basically because we have an existing relationship with BCIL, who oversees the PCAs, and we have a very small staff capacity. So it's been a very successful program. The big challenges that we see are regulating family members, working with home health agencies. It's a vast pool of people who provide care, so we really need to look at how we manage the program, how we oversee it, and how we support the most number of people while preventing abuse by people who are going to use this placards just to park in the neighborhoods.
So we'll open it up to questions. I have a couple, but I want to make sure that Councilor Zakim gets, he and Councilor Flaherty get to roll their questions out first. So Councilor Zakim.
Thank you, Mr. Chairman. Thank you, all three, for your comments and for relating your experiences already in this area. I guess there's a couple approaches. I mean, it seems like, a placard or something similar. We have our resident permit parking program, something along those lines, or perhaps, as occurs to me, given the potential for abuse with placards, which I know Councilor Flaherty is something that he's focused on over the years, and perhaps this is for you, Commissioner Fiandaca. What about just providing and maybe working with the 2 other agencies of a standard of documentation that could get a ticket canceled after the fact? I think that probably lends itself, would be less likely for abuse, but someone could submit documentation, within the 3 weeks after getting it, and the ticket would be voided. Is that something that we have the technical capacity for? Do you see issues with that?
We do work with some of our partner agencies, with the Visiting Nurse Association, And through our enforcement division, Irene Landry is terrific, and we know that there are occasionally extreme hardship cases. So we work with our residents and their family members to show them some consideration, particularly when we know that it's a short-term event. But, clearly through the Office of the Parking Clerk, they do have the capacity to review and the expertise through the hearing officers to take into consideration additional documentation that would support dismissal of a parking ticket. And those cases do occur now.
Sure, and I know your staff has often been very helpful in those situations, but I think if there was a way we could set up, if you can provide XYZ documentation as you're employed as a home health care worker, and then the resident, who you're seeing has, whether it's a doctor's note or something, I'll leave that to the experts to say what the standard should be, and just as a matter of course, it would almost be like what happens if someone has a resident sicker and occasionally they still get a ticket, but in my experience and people I've talked to, they send that in and it's like that. It's much more of XYZ boxes are checked, we're done, there's no need to come in for hearings. That's something that your department would be open to and you think could handle?
Yes, we can work with the parking clerk's office to develop some protocol.
Thank you. And I guess, and I also want to make sure in this discussion that we're looking at there are two different aspects I think that are coming up. There's obviously the family members who want to visit, whether they're someone who's sick temporarily or someone who's disabled or someone who is, in their final time. And I think that's obviously something really important that we want to support, but it is also going to be much more challenging, I think, from a regulatory standpoint and from making sure that is not abused. And I want to make sure we're just keeping both tracks open. I want to solve both these problems, but I think also, from a regulatory standpoint, it's going to be much easier to regulate a home health care worker visiting a resident on an ongoing basis versus someone who's experiencing a temporary sickness or on their way, in their final days is, I think, important. And we want to make sure that we respect those both. But I want to just make sure we're taking both tracks because I think they're probably two very different solutions there. Thank you, Mr. Chairman.
Thank you, Councilor. Councilor Flaherty?
Thank you, Mr. Chairman. To Commissioner McCosh, the pilot program, you said there was about 20 applications. Is there a fee for that currently?
No, there's no fee.
Okay.
But we do have a vetting process, which it's a pretty detailed application. And we don't ask for a doctor's medical information, but we do verify that the residents are part of the PCA program through BCIL. So they work with an agency to get their home health care.
Okay. And then does the placard or the permission, does that go to the resident's address, or does it go to the healthcare worker's registration? How does that play out?
It's issued to the resident, so the resident holds it, and when their health care worker comes in for a shift, they take the placard and put it in their vehicle. And again, I said there were only 2 license plates allowed per person, so license plate numbers go right on the placard. And I have a sample if you'd like to see it, and I can have my
That'd be
chief of
great.
staff pass it on.
And then, because we spoke a little bit about the pilot program earlier, because the first I was hearing of it, and then to manage that, the 20 applications from a staffing perspective,
Yeah.
if you were to expand the pilot program as a potential opportunity to kind of
Right.
look at a couple different potential scenarios, what would that do in terms of, would that tax your department? Would we
Yeah.
need to get you some additional personnel?
I think we'd have to build it into our work plan for the year. And again, it would depend on the scope of the program. One thing that's different between people with disabilities and potentially different with elderly people is people with chronic disabilities. One person on our program is a teenage girl, and so she could potentially have home care for many, many years, as opposed to hospice care, which is usually pretty short-term. So it's balancing. We do a yearly renewal, so I think that would be critical to make sure people still need the program and they're still using it. And we also have the PCA's sign an agreement. The home care workers sign an agreement that stays in our office, that if they violate this in any way or the resident violates it, that the placard will be removed.
Okay. And then Commissioner Fiandaca, when you drive around the city, sometimes you see reserved for Consul General or reserved for MBTA vehicles. How does that program work, by which we have a parking space in the city? Mostly, it's for the most part, they're in the downtown, but it's, I guess, pseudo reserved for Consul General's office, MBTA, I can go through the list of them, but, and then whether or not that program, whatever that program is, if that could be expanded to include maybe home health care workers.
Well, the Consul General reserved parking spaces are through an arrangement with the State Department, so in front of in close proximity to their offices, we do grant them parking spaces.
Do they pay us for those spaces, do you know?
No, they do
Oh,
not
okay.
pay. In terms of parking for other agencies, you might see parking for members of the General Court around the MBTA data processing facility. There are parking spaces there. So areas where some individuals may need to have access to the facility on sort of an emergency basis sometimes, we do allow parking spaces there. Certainly we understand that providing access to resident parking spaces in our neighborhoods for home care providers, whether they're providing services to elderly residents or disabled residents or, just general home care help, is something that we hear all the time as well. We know that there are only so many parking spaces to go around in the city, and as it was indicated by Councilor Zakem, SEIU has 56,000 home care workers in the city. We want to make sure that we craft a program that really addresses the needs of our residents and provides access to services and support that they need in their homes without diluting the program as well. So certainly getting the expertise from Commissioner Shea and from Commissioner McCosh and our community partners and you as well will help us to identify exactly what the criteria needs to be so that we can implement a fair and equitable program that really does work for our residents.
And then like in a meet-and-mate situation, so they look up at the sign, they see Consul General, or they say reserved for the MBTA. But in the situation with the pilot program, what Kristen was explaining, meet-and-mates would issue the ticket, but then the ticket would be exonerated because it's in the pilot program, or like what would the signal be to the meet-and-mate to not do the ticket? Is it a placard on the windshield? Is it?
Well, we could have a placard that is a visible indicator to the enforcement officer. We could also take advantage of some of the technology in our handheld applications to create a database of placards and permit holders so that it would be similar to the resident permit database where sometimes the permit is obscured on the vehicle for whatever reason, but when the license plate is entered into the handheld, there's an indicator, a visual indicator to the enforcement officer that this vehicle does in fact have a permit for that location.
And has there been a situation, Kristen, where someone in the pilot program has actually received a ticket? And if so, then what's that process?
We have, we've had people who've received tickets, and my staff usually just calls the parking clerk and they resolve it.
Okay.
But what we do now is we update the parking clerk's office on a monthly basis with the people who are in the program and the license plate numbers. So they typically know which license plate numbers are valid, and they'll read the placard in the windshield, so usually they don't get issued tickets. And I should also add, too, that this program only gives the home care worker license to park in a certain neighborhood. So that says it on the placard,
Gotcha.
too. So if they're working for someone in South Boston, they can only park in South Boston resident.
Right, and that's, I mean, obviously the technology will help drive that as well. So that's great news and on the pilot program, and if you have capacity, we'd be excited to see if we could expand that to include some other categories. But thank you all, commissioners. Thank you, Mr. Chairman.
Thank you, Councilor Flaherty. I have a couple questions. Ultimately, I think we all believe that it's a good idea that, people can come and help other people without getting ticketed. So it ultimately becomes an operations issue, an operations question. And we all know that some, good deeds don't go unpunished. And I think that fraud is certainly an issue where if people are assigned a placard and they're going to the Red Sox game, next thing you know, they're parking in Josh's area, and they're from JP or they're from Brockton or wherever. They're going to the, they're going to the convention center. They're going wherever. It's an issue. So I think operationally, we have to figure out how we can track people. So, for instance, my dad got his knee replaced. He had a home care person coming in doing PT, 4 times a week for a couple, 4 or 5 weeks. we have street parking, so it didn't matter to him, but I could see that that would be an issue. So that would go through his health insurance. Is there a way operationally that we can track PT appointments? Like, for instance, Good Shepherd is a hospice care. We unfortunately had to use them last year. Again, we have street parking, but the people who were coming in and taking care of my mother-in-law, if we were in the North End, it would have been problematic for them, no doubt about it. Can we work with other organizations to track when and where and what people, because they have an appointment schedule as well?
One thing that we do on the application for the pilot program, we have the resident check off what days and hours they receive services. So we have the check boxes Monday through Sunday. In hours, we do it from like 7 a.m. to noon to 5 p.m. and 24-hour care also. I think it may be very labor-intensive to actually get specific schedules from people, but if we have the general, if they attest to, on the application that they use them for those certain hours, that's worked well for the pilot program.
Okay. So what I'm envisioning, and this could be way off, and as we get into a working session and continue on with it, one of the thoughts that I had as I was prepping for this meeting was if residents of the city of Boston knew about an application. So, for instance, I have somebody in my house, my dad, he's got his knee replaced, he needs help. We're in North End, we have resident parking, we understand it's going to be an issue. We could apply online and get a form that says, you know, from BTD that it's a temporary placard. These are the hours, we've set the schedule for 4 weeks, or, and God forbid, hospice care, you know, as Josh said, it's generally not a long period of time when it comes to that period. Could we begin to think about creating an online application where we're going to need hospice care, we're in a resident parking area, we can apply, we can have the documentation from Good Shepherd or whatever hospice care is needed for a short window of time, get that, and then hand that to, you know, the hospice care provider, something like that, and then where it has a beginning and an end. And we all have a beginning and an end. Obviously, that's what we're talking about there, but that's a whole other issue. Would that be like a possibility of a quick handout where they can print it at home and say, you know, I'm just envisioning like one of Councilor Lamatina's people from the North End saying, you know, my grandmother's passing away, we have, you know, we're gonna need hospice care for 3 or 4 days. It could be a quick turnaround where you apply, you put in whatever, as Josh said, you know, like XYZ, these are the things you need. This is the 2-week period where this barcode is alive in the North End.
Well, there certainly is the technology there to manage something like that through the parking clerk's office. I see a couple of issues here, and one is that there's a population of residents that need home care support. And then there's the population of supporters that work in the city and need access to a variety of neighborhoods at different times. So I think one of the objectives of the working group would be to identify how we best meet the needs of our residents through such a program, as you indicated, Councilor, that the resident would apply for this parking permit and provide it to their individual provider. And then there are the agencies that we work with, whether they're the Home Care Alliance or some of the other agencies that have employees that request access to a number of our neighborhoods at different times.
Right. I agree with you. I think Councilor Zakim hit it on the head where you have the professionals, the hospice care providers, the PT providers, and then you also have the family. We certainly don't want it to be a professionals versus family issue on this, but you know, we'll probably get a couple bites of this apple, but I think that the professionals, we can come up with a solution quickly on that, I would think. So as we move forward, I'm looking forward to working with all three of you, as always. So, Councilor Lamattina?
No, I'm just going to be brief. I think that a working session could handle this. I don't think this is rocket scientists. I think if they're registered healthcare workers and they're working in the neighborhoods, we should be able to accommodate them with placards. A lot of times in these residential neighborhoods with resident parking, a lot of folks leave anyways in the mornings to go to work, so there's spaces available. Just like I said, I'm a little concerned about seniors, because I know that some seniors do need care from their family members, but I also understand and I know for a fact that there's room for fraud. So I think that the healthcare issue is very easy for us to solve, but I also know that we need to look at something for our seniors. Because I hear that every time we do implement a new resident parking program in the neighborhoods, we get the seniors that call us up. And Commissioner, you've been very well working with us in East Boston with some of those issues, and I'm sure we could do that in other neighborhoods. But I'm looking forward to the working session. I think we can handle this all out. Thank you.
Thank you, Councilor Patina. Councilor Sabi George?
Thank you, Chairman, and thank you, Councilor Zachem, for bringing this to us for this work. I do have a question, and it sort of extends the issue to conversations that have happened, I think, at the council, maybe informally or during other transportation hearings, and that is about the itinerant worker in our schools who face a similar problem. So if you are a specialized caregiver when it comes to speech pathology or physical therapy, and you travel from school to school in the city offering or providing those services to our students, you're often faced with the same sort of parking crisis, and also have sort of a very limited window of time in order to provide those services, that is during the school day. And making sure that our itinerant workers can reach all of their students in a given day can be challenging, as well as some of those professionals that carry, and this is also when we talk about home health care, carry maybe large and cumbersome pieces of equipment to give that care, and how proximity to whatever the location, whether it's a school or a home, is important for us to manage. So I sort of want to add that to it, and also wonder, and we're talking a lot about, I think, sort of an older generation when we discuss this. When I had my kids prematurely, they early on received early intervention, speech pathology and physical therapy and OT as well, and those caregivers on sort of the other spectrum of life also require some assistance. So I think this is it's an important conversation for us to have. It's an economy within our city that we need to be able to support, and not sort of penalize people for going about their daily business. So just want to sort of add that to the mix, and wonder if there's a place where that conversation could also happen, and whether this sort of sets sort of the parameters or the guidelines for that extended conversation, but want to put that on the table. I am curious as to what other cities are doing. I don't know if Commissioner Fiandaca, you can speak a little bit to some of the work that's happening in other places, or Commissioner Shea. I'm not sure who may best answer that.
Yeah, we were able to take a look at some of the cities that were listed in the document you provided. So Washington, D.C. Does have healthcare providers driver registration. So they do have a permit for healthcare providers. They require a driver registration, a DC license, insurance, proof of residency for the person needing healthcare, and a statement for the doctor. Chicago, this is not just for healthcare workers, but really for anybody. They offer guest passes. So you can buy a sheet of 15 guest passes for $8 a sheet, and you can buy 3 of those sheets per month. So you could get 45 guest passes per month. And then home care aides can sometimes buy more if they are purchased through their employer. San Francisco, the healthcare provider needs a California license, a yearly letter from the doctor, proof of residency for the person needing healthcare, and they charge $128 for the pass for the year. And then Austin was listed. We had a little bit of a challenge. We did call down there, but they didn't know anything about their program. So, but it's $16, whatever their program may be.
I'm all set with my questions. Thank you very much.
Thank you very much. We'll open it up to any public testimony. I don't have the sheet. If anybody would like to speak publicly, there's certainly more. Oh, we do have a sheet. Thank you, Juan. Thank you. Okay, we have 4 people, I believe, who would like to speak. First is Sidney. That'll do it. Yep, welcome.
Thank you, council members and commissioners for holding this hearing on this issue of healthcare provider parking permits. My name is Sidney Axelrod. I'm here today representing the Home Care Aid Council. Established in 1967, the council is a nonprofit trade association that has been advocating for over 50 years for home care aides, for the people we're talking about here. These aides are the frontline professional caregivers employed by home care agencies. They provide our seniors and individuals with disabilities the direct care services they need to remain safely in their homes. Home care aides are the fastest growing occupation in our nation, or one of the fastest growing. A recent study of the Massachusetts workforce data commissioned by State Auditor Suzanne Bump found that personal care aides will be the largest single source of new job creation in the nation between 2014 and 2024. Home health aides are the third. So combined, they will account for 1 out of every 12 new jobs created in the United States. So continuously growing workforce here. The council is very eager to work with the city to think about strategies to address the problem of access to parking for home care aides. We've worked closely with Elderly Commissioner Emily Shea on a number of issues throughout the years. We've discussed this issue on several occasions. It sort of keeps coming up for us. Our colleague Haley Gleason, through her role at UMass Boston, worked with Commissioner Shea and the commission to implement those age-friendly listening sessions last year that were held by the city. On many occasions during these sessions, seniors living in Boston raised the issue of how their home care aides struggle to find parking when visiting their homes to provide care. They also noted that their care can be interrupted when their home care workers need to leave to move their car because of time-limited parking. So it is having a real impact on the elderly community, on the consumers here. We also want to mention that our council has partnered with the Boston Housing Authority on a recent grant to train BHA residents to work as home health aides. In a study that was conducted as a part of this project, we surveyed home care aides, and travel, which included dealing with parking, tickets, meters, all of it, was one of the top reported challenges of working as a home care aide. So this is a really significant factor in their quality of job and job retention and these high turnover rates we keep seeing. So we urge you to consider these critical issues that these frontline workers are facing as we work to address this issue. The Home Care Aid Council is very eager to serve as a resource to you as you move forward to working sessions. If you have any questions regarding this workforce and their particular needs now or in the future, we can also provide you with some more detailed reports of any of those projects that I just mentioned. I did provide a packet for you that has some summary information just about our organization and the workforce itself. So thank you so much.
Thank you very much for that information. Milka?
Good afternoon, everyone. First of all, I'd like to thank God for giving us a chance to be here. My name is Milka Exantus, and I'm a member of 1199 SCIU, and I'm a personal care attendant for my parents. I take my parents to their medical appointments, to church, and where they needed to be. I clean and cook, provide service for them, and keep them updated on what is happening publicly, and travel with them whenever I have to. In essence, when it's come to external and internal affairs, I have to be with my parents most of the time. In taking care of my parents, the biggest difficulty that I've had to encounter in the city of Boston is with parking. When I come to take care of my parents, I often have to go to the visitors area. And if the visitors area is fully occupied, I have to park across the street. And they are often, the neighbors are not happy when you have to park in front of their house. Sometimes, when I have my car in front of people's home, you either find a car scratched or sometimes you might have a flat tire. In the winter time, I cannot park on the street at all because neighbors are cleaning their own spots, and you cannot park if you find the spot already clean. I have also received tickets in some occasion for parking on the street. I am asking this committee to provide some type of visible designation, such as a sticker, for home care workers so that parking and access to take care of our consumers, patients, can be made accessible and permitting, especially for caregivers of seniors and people with disabilities. I and most PCA's workers need access to our patient, client, or consumers to provide normal and urgent care. We do not want barrier between us and our care, especially in terms of parking. I hope that this committee, give my testimony a strong consideration. And I thank you all, city officials, who give your time to listen to us in order for us to provide good care for our consumers. Thank you.
Thank you very much, Milka. Patricia?
Good afternoon, everyone. My name is Patricia Haven. I'm a PCA with a disability. I was in a motorcycle accident in 2006, so I have a rod, a screw, and 30 plates in my right leg. So I was in a wheelchair for like 3 years. I had to learn how to walk again. But I'm a PCA for a friend of a family. And it's hard. Like some mornings, I can't find nowhere to park. And, you know, it's hard. Like she lives on Mass Ave, but I have to park sometime almost all the way by Ruggles to have a parking space. So, you know, some mornings it's hard for me to park, and there's only residential parking. My car's been towed about 3 times. The cost was $150 plus $70 a day, which I work 4 hours a day, so I really can't cover the $150. If you tally what I make compared to what it costs to get a car towed. So I understand what you all are saying, but I just hope it's like a quick turnaround process because it's hard. You know, I'm a PCA and I have a disability, so I know from both ends it's hard for us to park. And I'm kind of rambling around, but being a single parent, it's hard for me to pay for a tow if I get towed. And my consumer, I've been with her for like 6 years, and she doesn't have, she's in a wheelchair too. She doesn't have access to do any of the things. And if you leave it up to the consumers to follow through with getting the passes going, it'll never happen. Because some of the consumers just don't have the ability to do it. So I don't know who we're gonna put in charge to do it, but I don't think, it's like probably gonna be overwhelming for the consumers if you all say they have to do a process of application and all that. Like, it's probably gonna be a hard process. So if we can make it as easy as possible for the consumers to make it accessible for us to have parking, we really would appreciate it. And I also represent 1199 as a PCA. Thank you, I appreciate it. And one more question. So what if we have 2 consumers in different areas? I heard you say that you can only be at one place when you have, so you have to do 2 different processes, or can you extend it to say we can be in Dorchester and South End under that same pass, or how would that go, like
So
for a PCA?
I think I can answer this. We're going to be having a working session, so a lot of the questions that came up will be answered. We're going to do some homework on what other communities and cities are doing as well to try to get a good foundation onto the project and the program that we'll at some point move forward with. So there's really no answer. I think that the comment that you were making was that, I think it was Commissioner Fiandaca had mentioned that one of the cities, or maybe it was Commissioner Shea had mentioned one of the cities has a permit just for a particular neighborhood. That's probably not where we would go with that.
Okay. And how long do you think and what's the process from here for us to get a pass? Like,
So
is it a time frame when we're gonna work with? Or?
there would be no time frame. We'd probably work with Council Zakem and Council Flaherty and the administration to get a working session together, which will probably happen sometime after Labor Day, where we'll do our homework and our due diligence from now until that date, and we'll sit down at a table in here and have another meeting discussing what we found and where we can go. I don't know if we'd have a solution by that time, but we'll try to move this along as fast as we can.
Okay,
But
great.
I think we have one chance to do it right, so you have to do it right once.
Okay, great. Because
Thank you,
like I
Patricia.
said again, walking from Ruggles is crazy. Some mornings is okay, but on a rainy day, it doesn't happen too well.
Right.
Thank you.
Thank you.
Appreciate you all.
And last but certainly not least, back to his home squad, Darren Howe. Welcome back, my friend.
Thank you, Councilors, Veterans Affairs and Neighborhood Services. Thank you for hosting this hearing around parking permits. Pleasure to be back in City Hall. I'm here on behalf of 1199 SEIU, where we have over 5,000 PCAs just in the greater Boston area, 8,000 members in Boston total, and 56,000 statewide. So thank you for having this hearing. And I'd like to commend the approach around parking that the city has taken in the last 4 years. I mean, there's a digital program, there's an application. I think there's some things that have been done that could be adopted during the working session that you all could look at. As you were sharing things, I was thinking about who should be issued the parking permit or the placard. I know as Patricia just testified that it would be difficult for maybe some consumers to actually go about filling the application process out, but was thinking maybe having some type of time stamp on when that card can be used, but only if the consumer has issues it to whoever the home health aide is or the family member is, so that there's some type of measuring the time, just like with the parking app. Like there's a certain amount of time you can actually have it on. So was thinking a digital approach maybe would help resolve some of these problems. I know also as it relates, there's so many residential areas that have happened in the last 4 years that not just parking for the most vulnerable population, but just in general, people can't afford insurance, so their car can't be registered at their address. So you're gonna come up with these concerns in other areas as well. So thinking the digital approach probably would be the most efficient and effective approach to just being able to measure and deal with some of the concerns that will be raised around fraud and who has actual usage to it. Also was looking at the handicap placards, unless you need something hard and tangible to put in a vehicle, using something like that. There is a facial recognition of who actually is on that placard, who can use it. So making sure that there's some type of connection between whose car is it going to be on and who actually is the reason for the person. And also was wondering, for a lot of these residents, they might not have cars, but they live in residential areas for parking. So are they not issued a parking pass because they don't have access to a car? Like that is a concern that, you know, came up while people were sharing the thoughts behind this initiative. I know quite often people, this population, don't drive. You know, that's why they have personal care attendants and home health aides. So what about the spot that would be issued for them for being a resident of that neighborhood? I think that should be taken into consideration too when thinking about how you roll out this program. But 1199 is in full support. The members just shared some of their personal stories on how they're affected by not having access to parking. And when members are making between $11 and $15 an hour, any tickets, especially if there's multiple tickets, can become a financial burden, not only on that individual, but their family as well. So thank you for having this hearing and listening to my testimony. Thanks.
Thanks very much, Darren. Is there anybody else who came in late who did not sign who would like to testify today? Okay. On behalf of the City Council and the Committee of City Neighborhood Services and Veterans Affairs, I'd like to thank Commissioners Fiandaca, McCosh, and Shea for joining us. I'd like to thank Councilor Zakem and Councilor Flaherty for bringing this very important issue to the forefront. This has been docket number 0918 in order for a hearing regarding healthcare provider parking permits in the City of Boston. This hearing is adjourned.